Osteoporosis is a silent disease. The consequences of osteoporosis is quite serious, and it is a fragility fracture. Some fractures, for example hip fracture, has a high impact to the patient and the national and social, and may cause disability in those who sustain hip fractures. So it is important to employ primary and secondary prevention for osteoporosis. For those who diagnose with osteoporosis or sustain a fragility fracture, they should be advised for an anti-osteoporosis medication. And for those who carry the risk factors of developing osteoporosis, such as women who age over 65, or men who age over 70 years, or women with risk factor of osteoporosis, such as family history of hip fracture or early menopause, they should be sent for a bone marrow density testing. This test is quite simple, easy to conduct, and non-invasive, and should be performed as a screening tool for primary prevention of osteoporosis. My research interest is in both joint replacement and marrow bone diseases, especially those research that can be combined between two fields. For example, the role of vitamin D in total joint replacement, or the use of an anti-osteoporosis medication for the prevention of total joint replacement complications such as fractures. Orthopedic surgeons are specialists who treat the conditions related to the musculoskeletal problems, mostly require surgical intervention. Currently, in the field of orthopedic surgery can be divided into 9 subspecialties in Thailand, including trauma, adult reconstructive surgery, spine, sport, hand and microvascular surgery, foot and ankle, tumor and metabolic bone diseases. Some of my research have an impact at the national and international levels. For example, I just published a data that demonstrates the effectiveness of the Siriraj fracture response service and presented results about 3 years of this center. This study just re-emphasized that the fracture response service is important and should be conducted in all centers or every hospitals in Thailand. We just published another recent study that demonstrated the adherence and persistence of using an anti-osteoporosis medication at our center. Surprisingly, only 40% of the patients who indicated to receive an anti-osteoporosis medication receive the drug. So there are some ways, or there are some improvement, or there are some room for improvement even at our center. I also interested in the cost-effectiveness analysis and conducted few simple cost analysis studies related to the osteoporosis treatment in Thailand. At Siriraj Hospital, we have a metabolic bone disease clinic with all metabolic bone disease specialists seeing these outpatients at risk every Monday. As for inpatients, we have Siriraj Fracture Response Service, which is a multidisciplinary team approach, including physiatrists, geriatricians, physical therapists, and nurses, and also orthopedic surgeons to discuss and implement a long-term treatment care plan for those patients who sustain a fragility fracture. So we hope that with all these measures, it will improve the long-term quality of life of the patient with fractures and probably the osteoporosis patient. It was recognized worldwide and was certified by the International of Osteoporosis Foundation in 2018. You can look up at the map of the best practice framework in the capture of the fracture website of the IOF to see how many centers and which centers in Thailand have been recognized and appeared in this map.